Hello and welcome. How are you feeling today? I'm so sorry that you're suffering of these migraines and headaches. Don't worry, today we're gonna help you relieve some of the pain that you're feeling right now. So, let's see, I have your medical history here. It says that you've been suffering of headaches and migraines for quite some time now. You have been taking over-the-counter medication, painkillers. Okay. Has this medication helped any relieve some of the pain that you're feeling? For a little bit and then it comes back. Okay. Let me see. I see that you have never taken CAT scan to see what's underneath. Okay. Now, you have been treated with an experimental drug for headaches. Did that help a little bit? It came back. Oh, I'm sorry. I'm worst. Okay. That's very important to know. So now let me tell you, here in our clinic we specialize on headaches and migraines that we normally don't seem a cause for them. Most of our headaches and migraines are caused by something that is underneath, something that is bothering us, a medical problem, or maybe we're not sleeping well, or even we're not eating well. So in your case, that has been ruled out, so we're gonna have to do a few assessments to determine more or less what is the cause, and we are gonna be working for that and give you a very good treatment to relieve some of the pain. Our treatments have a 90% success rate to remove these headaches and migraines, but we always have to look what's underneath to make it work. Okay, so we're gonna start by doing a medical exam and let's see what we see from there. At the moment, do you have a headache? Okay. Can you tell me in a scale from 1 to 10, 10 being the worst pain you have ever had in a migraine or headache, and 0 being no pain? At what level will you say that you are right now? Okay, yeah, that's significant, so we're gonna help you prevent some of that pain, okay? Very well. Have you ever had problems with the light? Let's say that you're in your bedroom and it's quite dark, and then you go outside to the sunshine. Have you ever felt pain when this happens? I'm not saying that it should be immediate, but maybe triggers a headache a few minutes after. Okay. Does your eyes hurt when you're directly in contact with light? Okay. Very well. So we're gonna start by checking your eyes. I want to see how it reacts to the light. That is a big clue that we have that light can be a cause of a trigger for these headaches. Okay, I'm gonna ask you to look forward, please. Now you're gonna be sitting very straight. Don't move your head or your eyes, okay? You're gonna look straight to me. Just like that. Good. Good. Very good. Good. Can you tell me if this light is making your pain worse or is it exactly the same? Okay, good. Oh, you have a good reaction to the light. No blood vessels broken. Your pupils look fine. That's a good sign. Okay, now you're gonna look to the wall. Good. 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 Very good. Okay, I'm gonna be lowering the light now. We're gonna do the same test. You're gonna start looking straight forward. I'm gonna use a different light. It's a little bit brighter, okay? I would like you to focus on this lamp here and its purple lights. Okay, very good. Excellent. Great. I don't see any change, which is good. Okay, very well. I turn on the lights again, okay? Now I see that you squinted your eyes a bit. Did it bother you when I turn on the lights again? Okay, that's a clue. Maybe it doesn't trigger your headaches directly, but it could be related. Now we're going to be doing an aroma testing. Sometimes aromas can trigger this kind of headaches. It can cause kind of an allergic reaction when we perceive an aroma that is triggering to us. Sometimes we don't know the relation between the aroma and the headaches, but it can happen. Okay, let me just get it for you. So in your case, we're going to be testing with 3 aromas that are most of the time the causers of this kind of issues. Do you tend to wear perfumes or lotions? Or someone in your house wears perfumes, lotions, maybe a spouse, a friend, roommate, family member? Okay. Now, I'm gonna ask you to close your eyes. Let me know the moment that you can perceive the aromas that I'm gonna present to you, okay? Here's the first one. Okay, good. Can you recognize the aroma? Kind of citrus. Good. Now here's the next one. Okay. Like alcohol, rubbing alcohol. Good. Here's another one. Can barely perceive it. Okay. Well, the aroma can tell us that you might be triggered by smell. Yeah. When you can perceive that aroma, it's a good clue that your migraines can be triggered by that. Maybe you're oversensitive to some aromas and can trigger it. Let's say that you have pets, especially cats. If you have a cat, you have a cat box, a litter box, and well, the aroma that the cats get out when they use the litter box, especially if we don't clean it very often, and I will say often, with 3 times per day or every time they use it. And depending on the kind of litter that you use for your cats, it can trigger headaches and migraines. I don't know if you have a pet. Okay. Good. I see here in your medical history that you don't have any food allergies, correct? Okay. Now, we are going to be checking your ears. Ears can be also a cause of migraines when we have an ear infection or we have troubles with our inner ear canal, especially on our inner ear. If there's a problem there, it can cause big headaches. So I'm gonna inspect the area. Okay. Good. Well, there is some earwax, but nothing too significant to worry about. Eardrum looks intact. Looks good. Let's do a little test. Let me know if you feel any discomfort or pain when I insert this tool. Okay, I'm gonna be scratching your ear a little bit. Okay, here we go. Any discomfort? Okay, how about pain? None? Very good. Let's check the other ear. Okay. Good. Again, a little bit of earwax. Nothing too serious. Eardrum looks intact. Very good sign. Okay, let's do the test here. Here we go. Any pain or discomfort? None? Good. How about here? Excellent. It's a good sign. Even though there's some trouble with earwax, it's not significant enough to be causing migraines or headaches. Very well. I'm going to ask you again in a scale of 1 to 10, 10 being the worst, 0 being no pain. How is your headache right now? It lowered. Okay. We're going to be doing a touch test. I'm going to be touching your scalp, okay? And I'm going to be also pressing some points. Any pain when I press here? How about here? Okay. In this area? Right here is where you tell me, right? Yeah, actually I can feel your vein right here. Have you ever had an accident, a concussion, or anything like a hit in your head? Not that you remember? Okay, no, I don't see and feel any bumps in your scalp. No laceration either. So you're telling me that in this area in specific is where you feel the most discomfort. Okay. How about right here? I'm gonna be pressing. Good. This area too. Okay, that's a big clue too. So I believe for your treatment, I would like to do an acupressure technique to release some of the tension that I perceive in these areas right here. Sometimes our lymph nodes tend to clog and cause pain, so it could be something that is triggering you, along with some aroma allergies that I'm going to talk to you about in a bit. Okay, I would like to check a little bit more in your ears. I'm going to use 2 tuning forks in this case. I want to see if sound triggers your headaches or maintains the same. Okay. Can you perceive the sound? Barely. It's actually soothing for you. Good sign. Let's go with the next one. Makes you feel good? Well, actually, tuning forks is a good therapy too for headaches. No, not triggering at all. It actually feels good. Well, we can actually put it into your therapy too with the acupressure. It works pretty well. Just want to make sure that sound is not triggering headaches either. Okay, let's finish by checking your mouth. Okay, I'm gonna insert this to your mouth. Say ah. Good. Everything seems normal here. Thank you. Very well. So what I want to work with you today is do an acupressure treatment, which means that I'm going to be putting pressure in certain points on your head, especially on the forehead area. Also with the sound therapy, with the tuning forks that now know that they help you soothe yourself a little bit, and I'm sure that it's going to work with it. Okay. I'm just gonna ask you to sit in a comfortable position. You can recline your chair in case you need it. You're comfortable like that? Okay. I'm gonna put your hair to the back because I'm gonna be using a few oils for the acupressure. Just gonna tuck it back so it doesn't fall down. Okay. Good. Is it too tight? Comfortable? Good. We're gonna start first with the tuning fork therapy. You can close your eyes or you can keep it open, but it works better if you try to enter into a relaxation state by closing your eyes, okay? Very well. Good. Excellent. It feels good. You can feel the vibrations. It's good. 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 Gonna press it directly into your head. Good. 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 Okay. Let's apply the oils. These are essential oils, regular ones, but I need it so it's a little bit more slippery and it doesn't get me more trouble for the pressure. Okay. Good. Okay, put it this area too. I'm going to be working with a gentle massage. Good. Very good. If at any moment you feel discomfort, let me know. it's nice and slippery. I will be using this wooden tool here for the acupressure. I'm going to be pressing directly into these points. If at any moment you feel too much discomfort, if it's too much for you, please let me know, okay? 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Releasing. 5, 4, 3, 2, 1. Releasing. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Releasing. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Releasing. Good. Now we're going to be using a cold pressure point with this. 5, 4, 3, 2, 1. 5, 4, 3, 2, 1. 5, 4, 3, 2, 1. Okay, we're gonna let you rest for a bit. I'm gonna be asking you again, in a scale of 1 to 10, how is your pain right now? Lower significantly. Excellent. That means the treatment is working and that we have a better idea of what is causing your headaches. Okay, now I want to finish with a little massage in the area right here, just to help the essential oils go deeper into your skin, releasing some endorphins by pressuring the points. It feels quite relaxing too. Good. Very good. Very well. Let me just clean the area because it gets a little bit oily. So now that we know what triggers your headaches, we're gonna have to follow a little homework at home. I would like you to keep a journal. In this journal, you're gonna be writing the moment that you start getting a headache and what you did the past 10 minutes before that, 10 to 30 minutes. Then after 1 week, I want you to check your journal and see if there are any connections between your headaches, if you still get them. And we're gonna see you again in a week so we can check this out and give you a full treatment to it. And of course, try to not do the things that are triggering you. Okay? Okay. You can touch the area. Let me know if it's good enough or you want me to keep cleaning it. Sometimes it gets a bit oily. Feels good? Okay. So now that we know we have a very good suspect of what is triggering you, and with the journaling that you're gonna be doing, I'm sure that we're gonna find exactly what is triggering you and help you resolve it 100%. I'm gonna send you home with a rubbing cream that I want you to use at home every time that you have a headache. Okay? You're gonna be applying this cream directly into these areas where I put the pressure. You remember? But don't worry, I'm gonna send you with a brochure on how to do it. Okay? So this is how it looks. You're just gonna take a little bit with your finger, apply it directly into the areas like this in circular movements, and you're gonna do a pressure point massage just like I did. Don't worry, there's no need to get a tool like this. You can do it maybe with a brush or with any tool that has a blunt part like this. You can do it yourself. And you're gonna be rubbing in circles for around 5 minutes. After those 5 minutes, you're gonna start noticing a change into the pain. Okay, so I have here your brochure, and do you have any questions? Okay, well, I'm very happy that your headache is feeling much better now, and I'm sure that it's gonna completely fade away after a couple of minutes. Let me just remove this for you. Any questions? Well, it was a pleasure. Take care. I will see you in a week. Goodbye.